for discussion today is third stage of labor. Outline of the content: labor, that is introduction, stages of labor, physiological changes during third stage of labor, types of placental separation, signs of placental separation, and management of mother during third stage of labor. Objectives: at the end of the class, the students will be able to define labor, enlist the stages of labor, explain the physiological changes during third stage of labor, discuss the types and signs of placental separation, explain the management of mother in third stage of labor. Labor is defined as a series of movements takes place in the genital organs in an effort to expel the viable products of conception, that is fetus, out of the uterus into the external world. There are 4 stages of labor. The first stage starts from onset of true labor pain to full cervical dilatation, that is about 10 cm. The second stage starts from full cervical dilatation to expulsion of the fetus from the birth canal. Third stage is from after the expulsion of the fetus to expulsion of the placenta with its membrane. The fourth stage is about care of mother and baby for at least 1 hour after delivery. Physiology of third stage of labor, which includes 3 physiological processes. Number 1 is placental separation. Number 2 is descent of the placenta. Third is expulsion of the placenta. So separation and descent of the placenta, which has been explained as that in the beginning of third stage of labor, the placental site has already been diminished in area about 75%. As this occurs, the placenta becomes compressed and the blood in the endovillous space is forced back into the spongy layer of decidua basalis. So because of the retraction of oblique uterine muscle fibers, which will exert pressure on the blood vessels, so the blood does not drain back to the maternal system. The vessels become tense and congested. When there is next contraction, the distended veins burst and the amount of blood which will seeps in between the spongy layer and the placental surface, which will help for stripping the membranes from the attachment. The non-elastic placenta begin to detach from the uterine wall. Separation begins centrally so that the retroplacental clot is formed. This will further help for separation by exerting pressure so that increased weight, which will help to peel the membranes of the uterine wall. The placenta descends with the fetal surface first. Regarding the expulsion of the placenta, because of the contraction and retraction of the upper uterine segment, the placenta is forced to fall into the lower uterine segment and finally into the vagina. So about the hemostasis, the hemorrhage is being controlled by 3 factors. The first factor is the tortuous uterine blood vessels are surrounded by the oblique muscle fibers. We call that as a crisscross muscle bundles, which has a power of retraction. So the muscles exert pressure on the torn vessels, which will act as a clamp, that is ligature action. So it is been called as living ligatures or physiological sutures of the uterus. The second factor is vigorous uterine contraction following the placental separation, which will exert pressure. So thereby the bleeding is controlled. Third one is activation of coagulation and fibrinolytic system. Regarding the types of placental separation, the first one is central separation. We call that the Schultz method. Second one is marginal separation, that is Matthew Duncan method. Regarding central separation, the detachment of placenta from its uterine attachment, which will start at the center, that will result in opening up of few uterine sinuses and accumulation of blood within the placenta. We call that as a retroplacental hematoma. And about marginal separation, that is Matthew Duncan method, the placenta may separate unevenly from the borders towards the center, with the maternal surface of the placenta appearing at the vulva. So there are 4 signs of placental separation. The first one is gush of blood. Number 2 is cord will be lengthened. 3 is uterus will become globular and firm in nature. 4th is uterus rises anteriorly due to the descent of the placenta into the lower segment and finally into the vagina, which will displace the uterus upward. These are the 4 signs of placental separation. And regarding the management of mother during the third stage of labor, the components include use of uterotonics agents, spontaneous expulsion of the placenta, assisted delivery of the placenta by controlled contraction, massage of uterus after placental delivery. The uterotonics or uterotonic agents. The drugs such as symptometrin, syntocinon, ergometrin, prostaglandins, which can be given for uterine contraction either during crowning or delivery of the anterior shoulder or end of the second stage of labor or even after following the delivery of the placenta. The second management is spontaneous expulsion of the placenta. Intra-abdominal pressure will help to expel the placenta spontaneously. There are three important requisites to be followed for complete delivery of the placenta, which includes gentleness, patience and care. The third management is assisted delivery of the placenta, that is controlled contraction, which has been used to reduce blood loss, to shorten the third stage of labor, to enhance a normal physiological process. So before giving controlled contraction, we have to check the following. Number one is uterotonic drugs are given or not, uterus is contracting or not, countertraction is applied or not, signs of placental separation are evident or not. The procedure for giving controlled contraction. First, we have to keep the left hand on the mother's abdomen over the uterus and we have to give the counter pressure. By using the right hand, we can hold the cord steadily and we have to give gentle traction in downward direction until the placenta and membranes are expelled completely. This is the procedure we have to follow when we are giving controlled contraction. Regarding the fundal massage, the uterine massage should be undertaken immediately after delivery of the placenta until the uterus is contracting. And we have to check the status of contraction of the uterus every 15 minutes for 2 hours and we have to repeat the massage if needed. So upon completion of third stage of labor, we have to continuously monitor the mother, ensure that the uterus is well contracted and blood loss is minimal. If there is slight laceration, that can be repaired immediately after delivery of the placenta. The vulva and perineum can be gently cleansed. We have to monitor the vital signs of the mother. Once the mother is comfortable, examine the placenta and membranes for any missing part. Regarding the examination of the placenta and membrane, we have to examine the placenta for any missing lobes, blood vessels, insertion of the cord, umbilical vessels, length of the cord and weight of the placenta can be checked. Infarctions, if anything is present, which are recent or old. Localized calcification, if there is any. To conclude, the third stage is most important and crucial stage of labor because it is a primary factor in determining whether PPH, that is postpartum hemorrhage, will occur or not, and it is one of the leading factor which will result in maternal morbidity and death. So being nurses, we are playing a major role in smooth conduction of labor and also monitoring the mother and baby throughout the labor. So these are the references. Thank you.